Well, the Life Esidimeni tragedy could have been prevented. This emerged during the arbitration hearing last year. Some psychiatrists had warned the Gauteng Health Department against moving patients, but the warnings fell on deaf ears. One of those psychiatrists is Dr. Mvuyiso Talatala, and he joins us now in studio to talk about preventative measures. Thanks very much, Doctor, for coming into studio. I mean, you heard there from the NPA's acting director, it hasn't ruled out, as it's been widely reported, it hasn't ruled out prosecuting government officials who were to blame. That's at least some good news.
Yes, it is good news. Obviously, it's technicalities of legal technicalities that we won't be familiar with, but we heard that they're going to refer the matter to the High Court for an inquest. So I think that will be comforting to the families especially.
How do you feel about this inquest taking place on the back of the arbitration hearings last year, which we know were harrowing for the families of the victims, for the families of survivors who had to go through in detail how their loved ones died, how they were treated, for them to now have to go through that process again?
I'm sure it's going to be quite hard for the families, but I think it's better that we respect the court processes. The legal processes usually take long, but it's important that we actually continue providing evidence so that we can actually get to the real truth of what happened. It's always said to have to go through the legal process, but I think it's necessary. Yeah,
and you testified at the arbitration hearings last year. What was that experience like for you?
It was quite a difficult experience because, firstly, one doesn't want to go and stand in front of a judge. But what is worse is also I had to go through the emotions of hearing about what and talking about what had really happened to the patient. Some of the evidence, we had it, but if you have not looked at it for months, that feels better. But once you have to go through it, it actually has its emotional toll on you as a person.
And once you hear it from the families of someone who lost someone they loved.
Yes, because at the time we're speaking for the patients, we didn't know the families in person. We didn't know how they were feeling on a one-to-one level, but once we're there, we could see the families, we could see their emotions, their tears.
In terms of the system as a whole in South Africa, we saw from the Life Esidimeni transfers that there were massive gaps in how things were done. Have those gaps now been identified? Have they been plugged? Are we operating better?
The gaps are well known. They've been known for years. I mean, it's in the policy of government to correct those gaps. But I think the challenge the government has had is to actually implement those policies that are supposed to correct those gaps without causing harm to the patients. Yeah. The error with Life Esidimeni was to try and discharge patients without developing community-based mental health services. So you are discharging the patients to nothing. You will actually end up with patients in the streets. And yet we've got good policies in the country that look into that, that should make us start working on developing those services. Your question is, are the services there? No, not yet.
So they're still not there. You were talking about community-based mental health care services, which we are still lacking in.
Yes, that is still lacking. Keeping patients in big hospitals is almost like a backup or what you are doing because you're not. There's something else you should be doing that is correct. It is not desirable to have these patients in hospitals at a much higher cost, and also remove them from their families. So we should be having these services in closer to their communities, but we still have not reached that level.
I mean, is that bizarre for you, given what we've just... what we saw was one of the worst things to happen in a democratic South Africa. It identified massive holes in the system of how we deal with the most vulnerable people in the country, and yet we haven't found solutions.
We have the solutions. We have not implemented the solutions.
Is money an issue as well?
I think yes. I was going to say I'm speaking for government. I'm not government.
Yes.
It's tough for.
But I mean, you're someone who works in the sector. Yeah.
It's tough for government because firstly they had to correct what had happened in Life Esidimeni and bring those patients back to hospitals or to some hospitals, which they have done. And they've done that correctly. That comes at a cost. Now then they have to then develop those services. They are trying. But I don't think the speed is fast enough, and I don't think the funding for mental health care, because I think to develop those services, you need adequate funding for mental health care. There is no separate budget for mental health care, so mental health care has to compete.
Perhaps there should be.
There should be, or there should be some way of getting some grant, some conditional grant from the national government to develop those community-based mental health services.
So when we talk again about community-based mental health care services, are those the NGOs that Life Esidimeni patients were sent to that were unlicensed? Are they, in theory, that answer to community-based healthcare?
No, that's part of the solution. That's part of the solution. You need to take the, there's a team that looks after patients in a tertiary hospital. You need to have a similar team in the community that can support the doctors who are working in the community, because psychiatry is a little bit unique in the sense that if you are admitted in a tertiary hospital and you get treated with a certain medication that gets prescribed by a specialist, you still need the same medication when you're in the community. So the doctors in the community will be uncomfortable to, one, continue treating with that medications, or to assess some of the patients and treat them. So it's the NGOs, it's the clinics in the community well-resourced, even with human resource.
I mean, that's incredibly worrying that we still haven't plugged the holes that were identified during Life Esidimeni. Thanks very much for coming into studio. And that was Dr. Mvuyiso Talatala. He, in fact, testified at the Life Esidimeni arbitration hearings that happened last year.